The pandemic has put all of us under stress, but some hoping to cope with the stress with more alcohol than usual could face some negative health effects down the road. Joining us this evening to talk about this is Dr. Joanna Chaurette. She's a psychiatrist with Hartford Healthcare at Natchaug Hospital. Thanks for joining us.
Thanks for having me today.
All right, let me ask you, how has COVID impacted alcohol consumption over the last year? I read statistics that it's way up.
Absolutely. The pandemic has shifted so many aspects of our lives. Some people have had more free time, some people have been more isolated, and some people were even trapped in really difficult living situations. And this can turn into using alcohol the wrong ways. Some people increase their recreational use of alcohol, while others have used alcohol as a way to cope with stress. Early in the pandemic, there were many jokes and memes on social media about alcohol use, including, to cope with parenting stress and work stress at home. And this almost became more normalized during the pandemic. Accessibility has changed. While bars have closed and many restaurants had closed, there have been the advent of alcohol delivery services. So it's actually easier to access alcohol than ever before.
Somebody listening to your voice, what are some of the signs that somebody has a problem now? If they're drinking every night, maybe sometimes in the afternoon, even if they're working, they're Zooming from home, what are the signs?
Absolutely. Even moderate amounts of alcohol or intermittent use can cause problems in someone's relationship. Clearly, if there are, accidents happen or legal issues, is a sign that there's a problem with alcohol. But other times people may use it to help them sleep at night, and then that can cause a physiologic dependence, which is very dangerous. And which results in a change in someone's brain and body. And those signs of alcohol withdrawal, if someone goes without alcohol for a day or two, would be signs such as increased anxiety, difficulty sleeping, sweating, headache. And this could be an emergency, and someone should seek assistance and medical evaluation right away.
All right, so where do you go for help? If you're suspecting, you know what, gosh, I'm having a little bit of wine every night, maybe too much, where do you start to get help?
Well, there are many levels and places to go for alcohol treatment. The first thing to do would be to seek out a thorough psychiatric evaluation, and that would help uncover any underlying factors that might be contributing to someone's alcohol use. A good place to start after that would be individual therapy or counseling to start looking at your relationship with alcohol and really what is the right amount for you. There are many FDA-approved medications to help with cravings and also to prevent use or relapse, if that is your goal. And there are a variety of day programs and residential treatment facilities across the state that can offer more intensive services and medical monitoring for withdrawal symptoms.
Dr. Chaurette, tell us about your upcoming webinar on this topic.
Absolutely. I'm really excited to be giving a webinar on this topic. And during my webinar, I'll attempt to answer the questions and clarify the big question of how much is too much alcohol. I'll talk about the medication options and the health effects of prolonged alcohol use on someone's cognitive, psychiatric, and physical health as well.
Dr. Chaurette, thank you so much for joining us tonight on this very important topic in a really tough time in America.
Yeah, thanks for having me.
You bet. If you're interested in attending that webinar, we'll have the information on how to sign up on WTNH.com and the